Welcome. Let's look at possible causes of cramping after sex in women we're able to deal with men the other time. This can include muscle strains, urinary problems, sexually transmitted infection, and much more. But the treatment will depend on various underlying causes. So there are many potential causes of cramps after sexual intercourse in women. Muscle problems similar to exercise to during exercises, straining the pelvic and abdominal muscles during sex can sometimes lead to cramping. So what do you want to do? Tight muscles, dehydration or walking the muscle in an awkward position can all cause cramps. When you reach orgasm, an orgasm can also cause cramp because of the intensity, because all the muscles are contracting and relaxing at the same time. An orgasm involves the involuntary contraction of the muscles in the pelvis and the pelvic muscle. So there is a fight. So if these muscles continue to contract intensely, they may cause temporary cramps after sexual intercourse. It could be as a result of bowel issues, like the digestive system can cause abdominal cramping, constipation, and gas are two possible causes too of stomach pain after sex. Then, of course, urinary problems. When you have problem with urinary tract, like the bladder or the urinary system itself, can also cause pain after sex. The bladder sits right in front of the uterus, and intercourse can sometimes irritate it. And of course, it can be as a result of sexually transmitted infection, STIs, such as chlamydia. It could be gonorrhea. They may cause abdominal cramping, including after sexual intercourse. Many sexually transmitted infections do not cause any symptom. So it is best to get tested. You understand? If you are going through anything. Because some sexually transmitted infection can also cause discharge from the penis or vagina, as well as pain during urination. The more reason you are going through something, you seek for help. Anxiety and depression. A 2020 study on female sexual pain found that anxiety and depression can cause dyspareunia. That's painful sex. Pain associated with sex may also cause or worsen already established mental health problems. It could be as a result of deep penetration, can lead to pain. A person may feel this with with pelvic thrusting, but the pain may persist after intercourse because of the bones around that area. It can be as a result of ovarian cysts. The ovaries are two small organs located on either side of the uterus, and these cysts sometimes grow on or inside the ovary, and this can lead to pain and cramping, particularly if they pull on the ovaries and cause them to become twisted. And of course, it can be as a result of ovulation pain, male test smears. This that some people experience during days 7 to 24 the day during their menstrual cycle. This can be it can include abdominal pain and cramping. And some people may find that sex worsen during their ovulatory pain from 7 days to 24 days. Can be as a result of fibroid, and when we're talking about fibroid, they are just growths that occur in the wall of the uterus. They are usually benign, they are not cancerous. That's what it means. They can cause cancer. Um, they can cause symptoms such as heavy menstrual bleeding and abdominal pain, as well as pain or cramps after sex. And it can be as a result of vaginismus. This occurs when the vaginal muscles involuntarily contract when a person has attempt to insert something, maybe sex toys or pennies. And it can happen during penetrative sex and vaginal medical examination, as well as the person trying to use tampon or something to menstruate. Pelvic floor exercises may also help treat vaginismus. Then we have another point, which is pelvic inflammatory disease, which is an infection in the whole female reproductive system is infected. It may cause pain and cramping during and after sex. And of course, sexually transmitted infection, such as chlamydia, gonorrhea, can cause pelvic inflammatory disease. It can also occur after medical procedure, such as the insertion of an IUD, intrauterine device, for family planning. It can be as a result of endometriosis, which is the growth of tissue similar to that which grows in the uterus in places outside of the uterus. You understand? And it can also cause pain and cramping both during and after sex. Other symptoms of endometriosis including heavy bleeding during menstruation and extremely painful period. It can be as a result of tilted uterus. In some people, the uterus tilts backward instead of leaning forward. So the medical term for a tilted uterus is we call a retroverted uterus instead of antiverted. See you in the next video.